My name is Melissa, and I will be your instructor. Throughout this course, you will be given little nuggets of awesomeness called practice enhancers. Practice enhancers are tools that you can use in your learning, and some of them you can use ongoing to help keep your accounts receivable in order. There are worksheets that you can print off, cheat sheets that you can download and keep on hand, and so much more. As we go through the course, you may hear this sound. You might start thinking that this is the sound of money, and you wouldn't be far off. We will use this sound whenever there are important tips or alerts that practices often overlook. Let me give you a breakdown of what you will learn in every chapter. Face it, learning insurance is like trying to decipher an alien language. Here, we will cover the foundational knowledge that is necessary to be effective in billing and getting paid. Vision care plans are ruthless and brutal to our bottom line. We will break down the best ways to navigate vision plans and the greatest opportunities that are sometimes overlooked when collecting every last dollar from vision plans. Now, when talking about medical, many practices struggle with the back and forth monotony of denied claims. Here, we will cover the issues that you may see in your office on the daily. Plus, you will hear a lot of this as we share some codes that we have been able to see slide right on through with the proper technique. Best practices before and during the exam. Proper planning before and during the visit will transform how simple billing and collecting can be for your office. Best practices after the visit. We have worked with practices that have multiple locations, a dozen doctors, and have their accounts receivable around $40,000 in their past 90 days bracket. And then we have practices with one doctor in one location with $100,000 sitting in their past 90 days bracket. Implementing these streamlined practices in your office will help to keep your outstanding accounts receivable from insurance and patients to a minimum. The less that's sitting in accounts receivable, the more that's sitting in the bank. In our industry, it doesn't matter if you have money due from a patient or an insurance company. One fact remains: if you're not billing, you're not getting paid. If you have already purchased the course, go ahead and get started. If you haven't purchased the course, I don't know what you're waiting for, but there's no time like the present. I'll see you on the other side.